Administering oxygen via nasal cannula. So the purposes of this are to deliver low to moderate levels of oxygen to relieve hypoxia and to allow uninterrupted delivery of oxygen while the client ingests food and fluids. For the assessment, assess the patient's skin and mucous membrane color, breathing patterns, chest movements, chest wall configuration, lung sounds audible by auscultating the chest and by ear, and also assess if there are any presence of clinical signs of hypoxia such as anxiety, decreased level of consciousness, inability to concentrate, fatigue, dizziness, cardiac dysrhythmias, pallor or cyanosis, and dyspnea. And also, lastly, don't forget to assess the patient's vital signs. So for the planning, assemble and prepare all the equipment needed. So this includes appropriate oxygen delivery system. So I have here nasal cannula. And then I have here a humidifier, a flow meter, sterile water or distilled water, a tape. I also have here an oxygen source, and as you can see here, the no smoking sign. Next, review chart for physician's order for oxygen to ensure that it includes method of delivery, flow rate, and titration orders. And then after that, perform hand washing. So after performing hand washing, identify the client and proceed with the 5 rights of medication administration. So we have right patient, right drug, right dose, right route, and right time. So, good evening ma'am, I'm Trix Legaspi and I'm your student nurse for tonight. Can you state your name and date of birth? Okay, so may I see your wristband? Okay, and then after that, explain the procedure to the client. Explain that the oxygen will ease dyspnea and discomfort, and inform the client concerning safety precaution associated with oxygen use. Okay, ma'am, so oxygen helps to ease dyspnea and discomfort. So remember that you cannot change the flow rate on your own because this may lead to serious side effects. And please refrain yourself from smoking to avoid fire hazards. Okay? Next, assist client to a semi or high Fowler's position if tolerated. And then insert flow meter into wall, outlet, or oxygen tank. Attach oxygen tubing to the nozzle of the flow meter. If you're using a high oxygen flow, attach oxygen tubing to humidifier. Turn on the oxygen at the prescribed rate and then check if the oxygen is flowing through the tubing. So next, hold the nasal cannula in proper position with prongs curving downward, and then place the cannula into the nares. So wrap the tubing over and behind the ears. Okay, so place gauze at ear beneath tubing as necessary. So if prongs dislodge from nares, replace promptly. So for the evaluation, assess for proper functioning of equipment and observe client's initial response to therapy. Monitor continuous therapy by assessing for pressure areas on the skin and nares every 2 hours and rechecking flow rate every 4 to 8 hours. Perform follow-up based on findings that deviated from expected or normal for the client. Relate findings to previous data if available and identify unexpected outcome. For the recording and reporting, record and report all pertinent information of procedure as well as the pre-procedure and post-procedure vital signs, and then document evaluation. So that's all for the oxygen administration via nasal cannula.